Imagine your street, the very place you call home, having a say in how long you live, and how healthy you are while you're here. Think about that for a moment. It's not just about your genes, the hand you were dealt at birth. It's not solely about the choices you make every day, the food you eat, or the exercise you get. It's about something more fundamental, something woven into the very fabric of society, your postcode, the place where you live. In Britain, this isn't a hypothetical scenario. This is the lived reality for millions of people. Some fortunate individuals enjoy decades upon decades of vibrant health, relishing their golden years with energy and vitality. They embrace life to the fullest, free from the shackles of chronic illness. Others, tragically, find themselves battling debilitating illnesses before they even reach the age of 50. Their lives are prematurely curtailed, their potential unrealized. It's a stark and unsettling tale of two Britons existing side by side. One where life stretches long and healthy, filled with opportunity and well-being. The other, a reality where life is often cut short, burdened by sickness and hardship. This health gap is like an invisible line, subtly yet powerfully shaping destinies. It dictates who gets the precious opportunity to watch their grandchildren grow up, to share in their milestones and create lasting memories, and who is forced to spend their days battling chronic pain, their lives diminished by constant suffering. The numbers paint a grim picture, revealing the true extent of this disparity. The statistics are staggering. We're talking about decades of healthy life either gained or tragically lost, a profound difference that cannot be ignored. And it all hinges on something as seemingly arbitrary as where you happen to live, the postcode you call home. This isn't just about cold, hard statistics and abstract data points. It's about real people, with real lives, real hopes, and real dreams, whose potential is tragically limited by the burden of ill health. Today, we're going to pull back the curtain and expose the hidden realities behind these numbers. We'll be delving into the hard data, scrutinizing official reports from the Office for National Statistics, the UK's largest independent producer of official statistics. Our journey will take us from the affluent, leafy suburbs of Wokingham, a picture of prosperity and well-being, to the vibrant yet often struggling coast of Blackpool, and finally, to the former mining towns of Barnsley, communities grappling with the legacy of industrial decline. These places, though geographically close, are worlds apart when it comes to the health and well-being of their residents. They share a country, a national health service, and yet their health outcomes are drastically different. Understanding the root causes of this profound divide is the crucial first step towards finding solutions. We need to ask ourselves, how did we arrive at this point? What systemic factors have contributed to this inequality? And most importantly, what concrete steps can we take to bridge this gap and create a healthier future for all? The gap is not just persisting, it's growing wider, threatening to further fracture our society. We can no longer afford to ignore this urgent crisis. The time for action is now. We often hear about life expectancy, a term that's become commonplace in discussions about population health and societal well-being. But what does it really tell us about the quality of those years? It's essentially the average age you'll live to, a statistical projection based on current mortality rates. While it provides a general overview, it doesn't delve into the nuances of health and vitality during those years. But there's a more important measure, one that paints a far more comprehensive picture of societal health and individual well-being. It's called healthy life expectancy. It's the years you can expect to live in good health, a period where you're not just alive, but thriving. It's about living those years free from disabling illness, chronic pain, or debilitating conditions that significantly impact your quality of life. It's not just about living long, but living well, enjoying each day to its fullest potential, working, contributing to society and pursuing your passions, playing, engaging in hobbies and activities that bring you joy and fulfillment, traveling, exploring new places and experiencing different cultures, enjoying life, connecting with loved ones, and creating lasting memories. When healthy life expectancy is low, it indicates a significant portion of the population is spending their later years in poor health. People spend more years managing illness, relying on medication and healthcare services to cope with chronic conditions. Arthritis, diabetes, conditions that can severely limit mobility and independence. Heart disease, mental health struggles, all of which can significantly diminish the quality of life. The ONS, or Office for National Statistics, measures this by directly asking people about their general health and well-being through comprehensive surveys. Healthy life expectancy is then calculated as the average number of years lived in self-reported good or very good health. It's a snapshot of national well-being, reflecting the overall health and vitality of the population, and a powerful indicator of inequality, highlighting disparities in health outcomes across different communities. When one area's healthy life expectancy is 15 or 20 years lower than another's, it reveals a stark contrast in the opportunities for a healthy and fulfilling life. It's a red flag, signaling deep-seated issues within the social and economic fabric of that community. This isn't random. These disparities aren't simply a matter of chance or individual choices. It's a predictable outcome based on where you live, on the resources and opportunities available in your neighborhood. It's a truth that should make us all stop and think, prompting us to question the systems and structures that perpetuate these inequalities. Understanding this concept is key to understanding Britain's health crisis and to addressing the root causes of health inequality. We often hear statistics, numbers that represent complex realities, but behind each number there's a human story, a life lived. Let's put faces to the numbers. Wokingham, an affluent Berkshire town known for its high quality of life, beautiful homes, and thriving community. It represents a picture of health and prosperity. And Blackpool, a seaside town facing deprivation, a town with a rich history but now struggling with economic hardship and social challenges. These are two sides of the same coin, two different realities within the same country. In Wokingham, women can expect over 70 years of good health, a long and active life filled with opportunities and experiences. They can look forward to enjoying their retirement, spending time with family, and pursuing their passions. In Blackpool, just 55. A stark contrast, a difference of 15 years. That's 15 years less of healthy living for women in Blackpool. 15 years stolen by ill health, limiting their ability to work, care for their families, and enjoy their lives to the fullest. For men, the gap is similar, 69 years in Wokingham, a time to enjoy the fruits of their labor, pursue hobbies, and spend quality time with loved ones. But in Blackpool, it's just 54. That means men in Blackpool face serious health problems more than a decade before retirement. Years that should be spent enjoying life are instead consumed by illness and hardship. Barnsley tells a similar story, another town grappling with the challenges of post-industrial decline, facing similar health disparities. Healthy life expectancy for men is 57, for women 56. A life expectancy far below the national average, highlighting the urgent need for intervention. These aren't just statistics, they're years of life lost to ill health, simply because of where you're born. A postcode shouldn't determine your destiny, but in Britain today, it often does. The postcode lottery isn't about winning, it's not about a lucky break or a chance encounter. It's about losing years of your life. It's about a system that disadvantages certain communities, condemning them to shorter, less healthy lives. The divide is stark, and it's repeated across Britain. From the north to the south, from coastal towns to inner cities, the pattern is the same. The data is clear. Your address can shape your entire future. It can determine your access to healthcare, your exposure to environmental hazards, and your opportunities for education and employment. This is a fundamental injustice. A society that values fairness and equality cannot tolerate such disparities. The health gap is real, and it's growing. The gap between the haves and have-nots is widening, creating a two-tiered system of healthcare and well-being. We need to face it. We need to acknowledge the problem, understand its root causes, and take decisive action to address it. Let's make this real. Sarah from Wokingham can expect good health until 70. Retirement, travel, family time. Julie from Barnsley? Her healthy years end at 56. She may leave work early, face chronic pain, and struggle with independence. While Sarah plans holidays, Julie plans hospital visits. This isn't a lifestyle choice. It's a life sentence by circumstance. Now, Mark from Wokingham can stay active and involved into his late 60s. Dave from Blackpool, with a healthy life expectancy of 54, may lose his health while still working. He could face a decade of poor health before retirement, affecting his family and finances. The cycle of poverty and poor health is hard to break. These stories are repeated across the country. The divide isn't just numbers, it's lived reality. The consequences ripple through families and communities. This is the human cost of inequality. It's time to confront it. What's behind this health divide? It's not just diet or exercise, it's poverty. Low income means stress, poor housing, and less access to healthy food. Manual jobs in places like Barnsley and Blackpool wear down bodies, leading to chronic pain and illness. Job insecurity and unstable work add mental strain. Even with the NHS, deprived areas have fewer GPs and longer waits. Affluent areas have green spaces and cleaner air. Poorer ones face pollution and fewer safe places to exercise. The legacy of lost industry means generations of unemployment and hopelessness. When people feel powerless, unhealthy habits rise. It's a toxic mix of hardship, environment, and stress. The health gap is built into the fabric of society. Then came COVID-19, hitting deprived communities hardest. People in the poorest areas were twice as likely to die from COVID as those in wealthier places. Overcrowded housing, public-facing jobs, and underlying health issues made the virus deadlier. Lockdowns delayed treatments, worsened chronic conditions, and deepened mental health struggles. The ONS reports healthy life expectancy has stalled or reversed since the pandemic. The gap has widened. COVID exposed and worsened the divide. The shadow of the pandemic falls darkest on Britain's poorest. Health inequality isn't just an English problem. Wales faces it too. Former mining communities in the South Wales valleys have some of the UK's lowest healthy life expectancies. In Monmouthshire, people live long, healthy lives. In Blaenau Gwent, men's healthy life expectancy hovers in the mid-50s. The pattern mirrors England's deprivation, lost industry, and chronic illness. The Welsh government is trying to tackle this with public health initiatives, but the challenge is huge. Decades of decline can't be fixed overnight. The health divide is a structural issue across Britain. Here's the cruel twist. We're living longer, but not healthier. In many poor communities, healthy life expectancy is falling. The extra years people gain are often spent in illness and pain. The gap in years spent in poor health is widening. The rich gain healthy years, the poor gain years of sickness. This strains families and the NHS, already stretched thin. The dream of a healthy retirement is real for a lucky few, but millions face long periods of ill health. Each generation should be better off, but for many, that promise is broken. The data shows we're failing a huge portion of our population. The divide is growing deeper every year. The numbers are bleak, but they're not destiny. Health is shaped by policy, investment, and will. We can choose differently. Advances in medicine and technology offer hope, but only if everyone has access. Equal care for all is essential. Public health measures, good jobs, warm homes, quality education build a healthy society. Tackling pollution, creating green spaces, and making healthy food accessible are key. Leaders must put health at the heart of every decision. We must value everyone's health, from Blackpool to Wokingham. The statistics are a wake-up call, not a sentence. With courage and collective action, we can close the divide. A healthier, fairer Britain is possible.